Hello there, and welcome to another edition of Falmouth Cares Business Roundtable. As always, I'm your host, Troy Clarkson, with our panelists, Gary Vacon, Michael Kasperian, and Bill Zammer. Today's show, we're getting back to basics. For the last couple of months, it's been our pleasure to bring you several guests, leaders throughout the community, political leaders, business leaders, so that we could have a conversation with them about the impact of the coronavirus on their businesses and on our community. Now that we've had a couple of months to really digest some of the information and to see how that first opening phase has gone, we thought it would be a good idea to really, as I said, get back to basics, talk about the impacts and use the experience of our panelists to really discuss in some detail with you what we're seeing in our community, what has been done well, what we can improve on, and how we see moving forward. So thanks, as always, to our experts for being here and sharing their time with all of you. And we'll start, as we always do, turning it right over to Gary Vacon, our tech expert, to really share with us how the statistics are unfolding and what the virus looks like here in Massachusetts and throughout the nation. Gary, great to see you, and as always, thanks for joining us.
Yeah, thanks, Troy. Okay, let me put this up. Okay, so this is the usual disclaimers. This data is as of yesterday, June 14th. The usual sources, a couple of new sources. Where we stand in terms of testing right now for the entire country is 7.19% of the population has been tested in total. And we're testing 0.15% of the population in the US a day. Massachusetts a little over 10%. Testing at about the same rate in terms of percentage of the population. Again, it's not a random sample, so forecasting is difficult. We've always talked about that. The corona growth factor now in Massachusetts is down to 0.2% per day. That's really amazing, an amazing accomplishment. United States is about 1%. We're going to come back to that and talk about other parts of the country and what we can learn from what's going on in other parts of the country. Here's the Massachusetts daily new cases. As you can see, this is ramping down really nicely. I think the last sample was something like 200 confirmed cases. And the testing rate is still pretty high, around 10,000 tests a day. So this is really good news. And the fact that this ramp continues is really good news. Hospitalizations are down. Still a lot of net discharges. We're down to about 1,000 people in the hospital now with COVID in all of Massachusetts. And the death rate is down to 30, 20, that kind of a number per day. All good news. So I wanted to move on, given that good news, with a discussion of, what's next? Is there a second wave? When does it occur and where does it occur? And talk a little bit about the surge in other states and see if we can learn something from that data. So let's talk about that. First, I want to start with these pictures. This is kind of interesting. This is the one on the left is from the Martha's Vineyard Times. It's a picture of Saturday evening in Oak Bluffs. I think that's Nancy's there. And the right-hand side, this is people on the Upper East Side of New York on Friday, June 12th. That's last Friday from the local television station. You can see people are getting together.
I have to step out for a minute, guys.
Yeah, people are getting together more, and there's more mixing of people, and not everybody's wearing masks. So here's the coronavirus data for the entire United States. You can see it's not tapering like it has in Massachusetts, but this is really a composite of multiple states, some of which are coming down, like New York and Massachusetts and New Jersey, and others that are going the other direction. So I wanted to talk a little bit about that as we go forward. But before we do that, I want to talk about the University of Washington model, which we reviewed every week. They're starting to now, given the opening, model a second wave of coronavirus in the United States. This is the United States model. And this is kind of the picture. This was the first hill. And here's the second hill starting to climb uphill in October. This is what they're thinking is based on the opening. So let's talk about the surge in other states that's been in the news quite a bit. And I've taken just a few states out as examples because you can't just look at the numbers. You got to look at the numbers carefully. Let's take a look at Florida. Well, Florida had a first peak in April and is having another peak now. We don't know how high this peak goes, is this continuing up or not. But when you do the analysis of this, Florida's growth factor, now remember, we're down to 0.2%. At the peak, we were growing 20 and 30%. Is growing at 2.6%, maybe accelerating, so that could get higher. But Florida has a population of 20 million people. So when you're looking at 2,000 cases a day, that's about 10 cases per 100,000 people, okay? So now Massachusetts, right now, we're at a growth factor of 0.2%, obviously 10 times better than what's going on in Florida, or 10 times less. And we're seeing about 200 cases a day with 6.9 million population. That's about 3 people per 100,000 versus 10 people per 100,000. And at Massachusetts peak, we were at 3,000 cases per day, which is about 43 per 100,000. So Florida is going up, but it isn't like, you can't look at this and understanding what the total population is and doing relative measurement, right? So, and we don't know how far this goes. I mean, this could keep going like this, or this could curve around, and no one knows yet. But we all know that Florida has done less in terms of restriction of motion than has happened in Massachusetts. Let's do Texas, which is going up as well. Texas has got a 30 million population roughly. Their growth factor right now is about 2.2%. Remember, we're down to 0.2%. 2,000 cases a day there and 30 million population. That's 7 new cases per 100,000. And we're at 3 new cases per 100,000. So even though Texas is going up, they're a little worse than twice as bad as we are right now. I mean, so just want to put that in perspective. And again, at our peak, we were 43 cases per 100,000 a day, and they're at 7. So they're nowhere near where our peak was. Are they headed for that peak? Good question. Arizona, probably the most frightening of all of them, is growing now at 3.3% and potentially accelerating. We don't know whether that's going to continue. And that's about 18 cases per 100,000. And understand we're at about 3, and we were maximized around 43 at the peak. So trying to put these in perspective. And then California, and I just want to talk a little bit about regionalization in this case, right? California is growing about 1% and perhaps accelerating. That's 2,500 cases or so per day with a 40 million population. That's 6 per 100,000. We're at 3 per 100,000. So they're kind of twice as bad as we are now in recovery, just to put it in perspective. But then if you break this down and you go to LA County, most of the cases, 1,500 of the 2,500 per day are in LA County, which has 10 million, a quarter of the population of California, which is at about 15 per 100,000. So, you got to kind of look at, regions and subregions to really understand what's going on. So then the question about what's next, the answer is, I certainly don't know. And although there are a lot of theories, I would also say that nobody really absolutely knows. There are models, but nobody knows for sure. We talked about regionalization. Here's a map of, hotspots across the country. And you can see, the red is kind of the most new cases, the fastest growth cases, growth rates around the country. And you can see that, it is highly regionalized. And then finally, I wanted to talk about this. So what happens now? One model is, as we reduce the number of cases, it kind of goes straight down and it just gets better and better. Another model is, we kind of swing up and down a little bit, right? And we work it back. Another model is go right back up to the new, or at least more like this green one with these states that are experiencing a second hump, where the second hump would be smaller than the first hump because we're not caught by surprise and people could kind of mitigate with social distancing and so forth. But that's the experiment we're running right now. And with that, I will hand this over to the group.
Gary, thanks very much. So some sobering information there, but certainly with all of the uncertainty about how the pandemic continues to impact us nationwide, I think we can say with some certainty that the steps that have been taken here in Massachusetts, the staying at home, the mask wearing, has had a definite positive impact. Is that a fair statement to make?
I think it is. And, I think the interesting question that nobody really knows is nobody really understands where the threshold is that causes it to go bad again. And is that threshold when you start having gigantic sporting events? Let's take the extreme. I mean, maybe you got to put a pile of people in the stadium to get it to, or is it, we have 10 people at a party not wearing masks? Is that the threshold? I think we're finding out where that threshold is. And one thing I think is smart is we're opening the door a little bit at a time and waiting 3 weeks to measure what the impact is. I kind of admire that. And I know that's been very difficult for business. In fact, it's been extraordinarily difficult for business. And I know we're going to talk about that now, but Troy seemed to have frozen.
Yeah. You there, Troy?
Yeah, I'm back. Sorry.
Well, we have a discussion prior to our hope they get some reaction from what you hear today. Just watches this. Maybe you can tell us, what you think. And for example, I've had a fascinating week. I was absolutely shocked at the amount of business my two restaurants did. The one here at the Flying Bridge and Clancy's in Dennisport.
Mike told us.
Mike, you were right. My wife was correct. I was dead wrong. I never expected whatsoever to do the kind of business we were doing. People were waiting for an hour to get into the place, and because we are socially distancing and doing all the things they have to do, and being very, very cautious. And the employees are being, they're running twice as hard, working twice as hard as they have to get stuff to people, food to people. But in that period of time, the people were behaving themselves at my places. They wore the masks. They were staying apart. They were adhering to what that we were asked to do, so we didn't violate any kind of safety precautions. And of course, we're concerned about the employees. So I was happy at that part of it. I feel badly for some of my other folks though in town, because I'm hearing rumors, not rumors, but facts. Mike and others are older, and they're at, how come they can't get more tables out into the pavement? We call it gutter dining now. They can't get more tables out there, or the restrictions, and where the restrictions coming from as compared to other towns, for example. Are we being as loose or more safe? Is there a liability issue on the sidewalks? There's something delaying their ability to do more business. And you got to remember, speed is of the essence right now in terms of allowing people to spend their money, I guess, and help these businesses out. And we always talk about restaurants, but the restaurants are a harbinger of what happens to the retail shops. The restaurants attract retailers. They're there, they're waiting for a table, they'll walk around and they purchase something. It might be an impulse purchase, but they're purchasing things. So it all on Main Street, Mike, you might take it away from it. It's all integrated. And it's so important that the town officials and everyone understand that this is the heart and soul. We have a beautiful Main Street. I mean, compared to a lot of towns, we've got to somehow maintain that. It scares me that that it won't happen. But you take it away, Mike.
Well, no, I mean, I think you're right in many regards in what you're talking about. And first and foremost, I think what we have to remember is that, based on the information Gary's given us, it's not only because of being great leadership from Governor Vacon, but that people have complied. And exactly to your point, people have come to your restaurant and behaved as you would say it. I mean, I think it's at a certain point, you have to treat people like adults and not like children, right? I mean, so if you're not safe, if you don't feel safe going out, well, don't go out. But if you feel as though you want to wear a mask and you want to go and support your local business, you want to go out to eat, you want to go to a retail shop, then by all means do that. Wear a mask, wash your hands repeatedly. I know many of the retail organizations have hand sanitizer. They have everything waiting for you. But it is very frustrating. And I think that you're right. You're very fortunate. You have a lot of space in your restaurant. You were able to really push out. And some of the restaurants along Main Street, are not that fortunate to have that. As you know, we tried repeatedly to come up with a plan that would be beneficial not only to the restaurants but to the retail merchants. Something there, and couldn't come together on anything like that. But I think there's also a lot of confusion. Like you, I heard from a lot of people this week, a lot of our restaurant members who were kind of frustrated at the fact that even though the town is trying to expedite, the approval process, and I know that, Select Board Chair Megan English Braga and Select Board Member Doug Brown have been high proponents of trying to really get things going. I think there's still some confusion as far as, what's permissible, what's not. It becomes more complicated to me personally when we're constantly talking to chamber executives from around the Cape and now really all the way up through Boston. And, there's newspaper pictures of people dining in parking spots in the Boston Globe and the North End. My counterpart at the Nantucket Chamber, who's also a member of the Select Board, has advised that, they've allowed people to put tables out into the parking spots as well. And so, I have people calling me and asking me, well, why aren't we doing that in Falmouth? I said, we're working on that. And, I understand that they're trying to expedite it, but I think the frustrating part for everybody is it's kind of coming down to this like interpretation of what the governor's executive order permits. Their guidelines. I know Dennis, I know Sandwich, when you have a restaurant, Dennis, as you know, and I think that every table matters in this way, in this particular environment. So, and I know that was something that when we were talking about trying to come up with a plan that would be beneficial to retailers as well as restaurants, a lot of the retailers we heard from who were really opposed to closing Main Street said, well, why can't the restaurants just use the parking spots in front of their I know that's something to the Select Board town manager, but there's going to be some type of, I think, more of a relaxation, and that's going to come from the state level, I think, with the retailers as far as, what's permissible. I mean,
to do that. And
I think, that's not, I mean, Frank, I don't think that's going to be an issue. I think that, the Select Board, when they had canceled the events in the summer, said that you could come back and they'd be more than happy to look at specific events. And I think that is, I know you're the wise sage one in the group, but to give you credit where credit's due, I thought it was a brilliant idea you had. Parking. The town picnic tables on the library lawn. That's going to have to be some movies on the library lawn. So, I mean, great opportunity to bring people. Going to be well.
We was talking about Main Street. What about in Woods Hole? I haven't heard much about that.
Well, I think that some of the restaurants down there have become very creative in their outdoor seating as well. There was some conversation with doing something with Luscombe Street as well. That's even a bigger challenge, as you know, than even Main Street, because of course that feeds the whole, steamship authority lot there. But people are getting creative. Again, when we talk about seating tables in parking spots, there's the perfect, there's another place, like all those restaurants that are along Water Street there, if they could come out onto the street, into the parking lots, you could put 3-4 tables per restaurant. You turn those tables over how many times, Bill? 4 or 5 times a night if you can, or whatever. I mean, that's going to translate. So, I think is really trying to interpret the law in the most liberal way permissible during this time, to take into account that people are desperate, that our business owners are desperate, and they need it. And I know people are coming. The phone at the chamber is ringing off the hook. People are coming down. You know, this weekend was busy. There was a backup on the bridge Friday again, coming on Cape. So we know people are going to come. We want to give our business owners every opportunity to accommodate these people when they come down to spend their money here in Falmouth and not hear about another town that they rather go to because there's more to do there.
And Michael, just for clarity, you're not talking about, when you're talking about safety, you're not talking about COVID safety. You're talking about, you know, how many tables can I put out? I mean, you're talking about, you know, you're talking about some of the other regulations.
Well, there's ADA regulation, okay, the American Disability Act. Obviously, the town has to look at that very seriously. There's the ABCC with the alcohol serving, but that seems to have been broadly handled by the ABCC. And so, yes, and then, of course, there's other issues as far as, the safety of people dining out there. But I don't know if you necessarily have to put concrete barriers down. A lot of places are not doing that.
I understand.
Slow the traffic down. You could put in speed bumps to keep the traffic going at 10 or 15 miles an hour. I mean, there are other ways around it. You could put police slowing people down. There's a lot that can be done. But it's also the COVID safety, too. I mean, at some point, right, we have to trust that people are going to do the right thing, maybe be there to help them. But
I don't want to dwell on restaurants. We talk about the economy. It does drive a lot of what happens in town with the people who want to be socializing, going out. So it does have an effect on the town or the tenor of the town, I think, as to what people want to do. They get out to see people and socialize. That's important. But let me just get into the regulations for a moment, just to give you some other thoughts of what's going on. With my employees, for example, I opened up now this week to finally open for dining, and I have my winter staff. I don't have my full staff in yet, because normally I bring in a lot of folks, foreign guest workers, because I just don't have the staff. We're geographically and seasonally challenged on the Cape, and we have to bring in workers. So right now, I don't have enough people to open up the 2 restaurants full time, and hopefully the visas will get processed soon, and I'll be bringing some folks in. But in the meantime, it's amazing to me. I have employees, some of them make a lot of money, who are sitting at home. They're for the past number of weeks. And one of the gentlemen who's very well paid, Bill, why am I doing this? I could sit at home and make was it $1,500, a little over $1,500 a week between his unemployment as a family, which is I guess $800 or something a week, and some change for children, plus the $600. This man makes $80,000 a year from me as my normal, as his pay, as his salary, in addition to healthcare insurance. And so now why am I working? Why don't you just leave the restaurant closed and I'll just collect unemployment for as long as I can. We'll all collect unemployment and stay closed. And I'm looking and saying, wait a minute, you just can't. We've got to open. We got to start working again. Well, the other people aren't doing it. They're still staying at home. So this disincentive to not working has become very critical. And I understand the fact that we do need to get money into the hands of folks, and the $1,200 check that they first got was good, and unemployment certainly good. We have now gotten to a situation where, and again, I love the comments from our viewers as what they feel about this. We've gotten a situation where there are proposals now to continue paying these and the ones who are working are looking like fools. Why am I working? That guy's staying home.
Troy.
Yeah,
kind of came in and out.
I'm here. Well, Bill, you raise a very, very legitimate point, and I caught most of what you said, and that's a real challenge. And Michael, I assume that many of your both restaurants and retailers are feeling that crunch as well. And so there's a tremendous amount of people out of work, but the system that's in place is a bit of a disincentive for that. And now what we're hearing is that additional $600 will end sometime near the end of July.
Right.
But that still is a challenge for our workers. Are you finding some of those same challenges that Bill is seeing?
Yeah, we've heard that from several people. They've had a really hard time actually hiring people, and other people who have called people back to work. And, people don't have to go back to work if they feel unsafe. So obviously, whatever the reason is, they're not going back. So I think there is a real labor shortage. Unfortunately, I think what's going to happen is long term, once that $600 runs out and whatever, some of the jobs that were lost may not come back. And then what ends up happening is people are really going to find themselves between a rock and a hard place, particularly if we don't, back to my original point, the time is of the essence. If it's not like a joint push between, our local government and people coming back to work and supporting their employers and their businesses, if these businesses fail, all those jobs are lost too. Plus the revenue that goes to the town in taxes and whatever else, So, it's very multifaceted. And, God forbid there's a second wave in the fall. And if we have to go back to a phase one, it could be detrimental long term. And I understand, Congress's desire, to keep pumping money to people. And I understand people who need money should get the money. But at some point, too, all that money is going to have to get paid back.
So you said July. They're now discussing about extending this beyond until what they call the end of the virus threat. It's awful.
Well, I think, Bill, what it does is what it has really done is highlighted a problem that has existed for a very long time, as you know. It's been I've been hearing from years about people that can't hire people anyway, and so it's just only compounded it with this situation the way it is. So it is an ongoing problem here on the Cape. So I think long term, if the Congress decides they want to continue to give families money, that's good. If families spend the money in the economy and it keeps going, but there's going to be more effort toward saving jobs, saving businesses, thinking more long term. I think. We don't even know what the long term repercussions of the money that's being doled out. Again, I'm not saying we shouldn't do it, but at some point, our kids and our grandchildren have to pay that money back.
I guess what are we going to look like? Okay, it's July 4th, it's almost here. It's almost here. We're going to go through 2 months of what we call pretty good business, yes. I suppose. And Michael, you're very optimistic about that.
Well, I was right last time, wasn't I, Bill?
He was right.
I was, wasn't I?
I was right. I was wrong too, but Bill.
Look at Labor Day. Let's look at the line of demarcation.
Yeah.
We now come in, and hopefully, I don't think there'll be a vaccine by then. But now look at Labor Day. So now what happens to the Cape? We have folks, who hopefully worked for the summer, made some money to put away in the business, because that's when we begin that so-called shoulder season.
Right.
Not bad, but it's still not even a third of what we would normally do. And if that third is less than a third now, it's going to be a tough period of time. So you really go from now, you get from Labor Day, and you really look at it from my business perspective, the way I look at things. I now go from Labor Day, I look at that short period of time between then and Columbus Day, another big day. And now I come back in to next April, because the winter is cold and dreary here on Cape Cod. Everybody leaves and all that. So you now have that situation. That's the survival time. But you've got to make it through. You got to make it between now and Columbus Day in order to survive into next April. And that's the key to all this. And that scares me.
Absolutely.
Gary, back to your numbers as far as the virus or the vaccine. Will there be a vaccine? I don't know.
I don't think anybody really knows. There's multiple scenarios, right? There's a vaccine. There's over 100 vaccine efforts, right? So you got to believe that somebody's going to figure it out. But it's hard to prove to go through all the testing that you have to prove a vaccine. There's ways to do it a little faster. Things like challenge trials. Maybe you've read about this. This a question about the. I don't know, the morality you have a challenge trial. Basically, you have challenge trial can give you an answer faster, but it's probably not the right thing to do. So it takes a while to prove efficacy. It takes a while to prove safety. I mean, all these things. Now, on the other hand, I mean, let's just look on the optimistic side. Even if there wasn't a vaccine, I'll paint an optimistic scenario. Maybe there are flare-ups, and those flare-ups are regional, and we're smart enough to tamp them down regionally or locally without shutting everything down. People, when they happen, people become compliant with the requests and act like adults. And maybe that happens here, there, and everywhere, but you can keep the economy going at maybe a higher level than we're going now, maybe kind of like a phase 3 level instead of this phase 2 level. I think anybody knows.
I think you're right. And, conversations we have continually, weekly with the Massachusetts Office of Business Development, they've talked in the past of the governor. Part of the governor's plan really is that regionalization. In the beginning, there was some talk of opening up the Cape and Cape Ann and the Berkshires a little bit early because they understood the seasonality of the businesses here. As a result, what ended up happening was I think Boston lagged behind really pretty much, but everybody else was on the same. And I think you're right. I think that would possibly happen. But on the flip side, I think it's areas like ours that are probably most at risk because we're going to be more than doubling our population during the summer, and then you're bringing people in from all over. So the risk of the numbers going up regionally are probably higher in Barnstable County than they are in other counties, and that's going to be the big challenge, I think. So
that's an excellent point. And, it brings me back to think about that picture that Gary provided at the beginning of the show with those folks on the vineyard over the weekend. And from a statistical standpoint, it's really difficult. Most of those people presumably were not from the vineyard. But if
right.
there's some infections that happened during that picture when there were hundreds of people gathered together without masks, then those people go home and become cases potentially where they're from. And so that's really something to think about.
I know myself, I'm making decisions about who to socialize with and who to be close with physically based on how I think they're behaving. And I know that may sound strange, but that is the absolute truth.
Yeah.
And I think that a lot of people are thinking that way. So the more, kind of mixed the crowd is where you don't have control of that, the higher the risk. I mean, so And as Michael points out, we're in a place where people come from other places to enjoy it. So whether they bring something with them, and then it just takes one or two to seed another outbreak.
I can tell you the phone traffic at the chamber is normal for this time of year.
Wow.
People for calling for information, and we're referring people to accommodations, and they want to know if the restaurants are open and other beaches open. People are coming. And they're going to be here. So obviously we have to practice safety, number one, in a responsible manner, and hopefully that'll all work out. The other thing that we have to consider as well is, Bill, as we know, and congratulations, your granddaughter just graduated from UVM.
Thank you.
We were up there because my daughter just finished her first year up there. We were up there gathering her stuff out of her dormitory. And so the question is, are they going back to school in September? Well, right now it's a resounding yes.
Find it out, right? I mean, you could think about the opening up as a sumo. It didn't get worse. Let's be honest. Again, you learn that, we could have restaurants outside and be really careful, and we could get our hair cut, and it didn't go up. So you try the phase 3, open the restaurants indoors a little bit, or the part 2 of phase 2. So I think we're going to discover through a progression of experiments where that threshold is, right? And then the question is, how good a world is it for economically that we can run under that threshold until we have a vaccine, right? And I don't think any of us know where that edge is. So far, I've been pleasantly surprised. I'll be honest. I've been pleasantly surprised that we've gotten this far, and I think a lot of people have, without it getting worse, you know? And the states that are getting worse, honestly, I mean, we all saw what they were doing in those states, right? So we work our way up, and hopefully it's a level at which business can coexist with the virus.
Well, you know, the other question that comes up with that too, Gary, is what is the public and the government's tolerance level for the percentage before they turn it back? I mean, at some point, if you don't have a vaccine and this thing's continuing, at what percentage point is going to be what people will tolerate in order to go back to as close to what was normal before?
Well, one thing for sure is you can't overwhelm your medical system, right?
Absolutely, right. So we know that.
There's an easy one, right? And then, you can't scare the living out of people either, right? So, I mean, those things are all true. I mean, so exactly where that is, I don't know. But, I'm optimistic that if we could adhere to masks and in crowded places and washing our hands.
Wash your hands.
And we would report ourselves if we were sick, and we would isolate ourselves if we were sick. If we could do all those things, that we could be more open than we are now from a business perspective, and it would still work. I'm optimistic, and that's just my opinion offered without proof.
And you know what, I got to tell you, last week before I mentioned to you guys that I had to go to the registry of motor vehicles, and I can't rave about the way they handled it up there. If every business operated the way the RMV is operating, hands to the Commonwealth for the way they're doing it, there would be no issues. Let me tell you, it was pretty amazing. And you could move people in and out very efficiently, very quickly into any retail establishments, restaurants, anything. Sporting events, any type of thing. They have it down. Let me tell you, they know what they were doing. So it is very possible to live with a small percentage of this. It's possible to live with this, I think, and keep moving forward until a vaccine is determined.
Well, and that's part of the key. And let it be said here that this is probably the first time in recorded history that anyone said that they wished private industry ran like the RMV. But
I think I heard that here.
But we'll give credit where it's due, and so I think that's the key, and that's what's unfolding. You know, as I was out over the last couple of weeks, I went and my wife and I had dinner at the Flying Bridge, and we were out at the quarter deck and just trying to support local businesses. And what we saw from our experience, by and large, is that patrons were very respectful. Most of them had masks on. If they sat at the table with another person, then maybe they took their mask off, but I watched so that I could report it on this show. The servers were all very respectful and really went above and beyond to make sure they were taking precautions. So I think Gary is correct. I think it's those types of simple but very important things that as long as people continue to do them, then things will continue to be okay. It's when we see things take a step back, as we did in that photo from the vineyard from the weekend, that really creates the concern. And we won't know if that was a problem or not for another 3 weeks, and we probably will never know because those people live all over the place, probably all over the country. And so, we try to be solution based on this show. So, what is the solution? I guess it's really just reminding people constantly about the masks and the hand washing and those sorts of things.
Hey, Troy, we got some interesting guests coming up in the next couple of weeks, I gather. And let's see, Justin, I just gave you. What do you think of the idea of a Zoom thing for the public?
Yeah, I think it's a fantastic idea. Bill texted me offline and suggested that we have the ability to take input from the public, because I think we're to the point where a lot of the things that all of you talked about earlier in the show about different ways different communities have rolled out supporting the restaurants and maybe ways we can improve on it in Falmouth, I think is really important. And I think that dialogue would be enhanced if we had people that could come on and provide feedback. So we're going to take a look at that, and whether that's through electronic means or getting people right on the show, we'll definitely take a look at that. For sure.
Awesome.
Great.
That's great.
Excellent.
So, here we go. Another week. We're looking, see what this week brings.
Yeah.
So Gary, your numbers will be lower.
Well, I
week,
have to
right?
say, look, I just want to, on an optimistic note, to end this. I mean, the numbers in Massachusetts are doing tremendously. And, I listened to Governor Baker's conference today, and he hinted that, he might have an announcement later this week if things continue to go well. So I suspect that there's some consideration given to the phase 2 second step, there'd be some inside dining and so forth. I don't know that for sure, but
Fingers crossed.
But the numbers, I mean, he says he's guided by the numbers. I have respect for that. And the numbers continue to look really good.
Excellent. So we will continue to have these discussions as long as they're helpful. As Bill said, we do have some great guests coming up in the upcoming weeks to talk about everything from how things are going on our beaches to how our seniors are being impacted by this, to some innovative solutions that the folks at the EDIC have. So we will continue to. I'm just getting my.
Falmouth kid. And, I'm glad that's a precursor. So Mike DeGiorno, who's the executive director of the EDIC, is going to be coming on board. And I got to tell you, we've been working with them, and they've been doing a lot on their own, just trying to really provide solutions. And, I mean, how fortunate we are to have an active EDIC like that in our town as well. So a lot of people working on solutions. You're right. That's what it's really all about. Partnering, collaborating. It's all good stuff.
It really is.
Falmouth cares, right?
Got it.
That's right. Falmouth cares, and that's why we are solutions-based. And and speaking of that, so because the Flying Bridge that has been the main shipping point for our T-shirt sales, we have just very few left, but we will be transitioning, and we're looking for maybe a retailer or two to agree to help us out and sell the few that we have left. So any that are watching this show, please reach out to us, let us know, and we'd be happy to have you join in our efforts. And as we mentioned, the last couple of weeks, we've raised well over $10,000 to support the Falmouth Service Center and Belonging to Each Other, a local homeless prevention nonprofit. And those efforts began right here in this roundtable discussion, and they will continue, and we'll continue to search for ways that we can support those great organizations.
Great.
So, as always, Flying Bridge owner Bill Zammer, who is now open for business for outdoor dining, president of the Falmouth Chamber of Commerce, Michael Kasperian, and retired tech executive, but very busy member of this team, providing details and data to us on a weekly basis, Gary Vacon. For all three of these dedicated Falmouthites, I'm your host, Troy Clarkson. We thank you for joining us.
Year-round employees as well. Year-round kitchen help. Anybody looking for jobs?
Amen. You heard it here first. All right.
There you go.
And we
Great onion rings.
Because Falmouth cares.
There you go.